Hey everybody, so today is my post-op day 2. Today's Friday. I had surgery Wednesday. I had to be rushed to the doctor today because I went to get a shower and my mom had to help me because I couldn't get my clothes off by myself. But I felt something warm down my arm, like underneath my arm last night. And she said she really couldn't see anything. But today when I went to get a shower, she took my bandeau off, which is this thing right here. She took it off and there was blood on it. And then she looked under my arm and it was like seeping out blood. So, called the doctor's office, and they wanted us to send a picture because I live an hour and a half away. Sent a picture, and the doctor said for me to come in, like, right away. And, at that point, like, my mom was talking to them while I was in the shower. So, after I got a shower, we hurried up and went over there. And, they gave me a new bandeau and put an extender on this one because the other one was way too tight on me. And it was like tearing into my skin under my arm. Which I knew it was hurting, but I just thought it was part of the pain. But she said it was like tearing into my skin. And then they took the tape seal stuff off of where my stitches are. Because it had bled through there. Plus the adhesive on the tape was tearing my skin up too. It like left a blister on my skin. So now I just have stitches showing, and I have a new bandeau on, and just pretty much got cleaned up. And what had happened was the stitches are all still intact, but I guess my incision tore a little bit for me like lifting my arms up, which is what I was told to do. But I guess it tore a little bit, and he said some of the antibiotic fluid that he put around the implants seeped out with some blood, and that's all it was. But so that was it. It wasn't a big deal. But he said it was better to just check it out and it be nothing than not check it out and it be something big. And I'm still out of breath. I get wind very easy. Standing, I get really lightheaded after like a minute. I was able to wash my own hair. I needed help washing my back, but I washed everything else. So my mom had to brush my hair for me, but you know, taking suboxone and having surgery, the medicines they want to give you that will help other people and knock other people out won't do hardly anything for you if you've been taking suboxone. So now it's already done, and I gotta tough it out. And I know it's just gonna be a couple more days of this kind of pain, so I'm getting around a lot better than I was yesterday, though, so that's good. So the worst part's almost over, and I'm gonna have great, nice, beautiful breasts afterwards, so I'm happy. I haven't had any withdrawal symptoms still, so that's good. And I guess it's because I have opiates in my system because of the Percocet that I'm taking. And I noticed what's been helping me a lot is the Phenergan. Even though it's for nausea, it helps me sleep because the pain kind of doesn't let me sleep. The Phenergan makes me really, really sleepy. So that helps a lot. The Neurontin helps with the nerve pain because they have to stretch the nerves when they go in. It goes from your shoulder to your elbow, and it goes the nerves that go to your nipples. So you'll have sharp pains in your nipples, and it hurts like, or even like your shirt to touch your nipple, it burns so bad. And the Neurontin helps with that. But this doctor doesn't give muscle relaxers. I've been having bad back spasms. And you would think a muscle relaxer would help relax your pectoral muscles so that your implant can drop faster. But he doesn't give muscle relaxers. So, I'm just kind of dealing with it. But it's almost over with. So, if anybody has any questions about today, then you can just ask in the comment section. And I've been eating normal food since surgery. Like, the night of surgery, I ate hamburger steak with white gravy on it, and country fried apples, and hash brown casserole from Cracker Barrel. My mom brought to me. So I ate that. Like, that was the first thing I ate after surgery. And I've just been eating regular food, so my throat's still not sore. They said they put a soft tube in my throat. So, haven't had any issues with that. I've heard some people complain about that, but I haven't had any issues. I have, during my breast massages, and today the nurse tried to show me some massages to do, and it was like really, really painful. Like trying to massage your breasts really hard when you're crazy and gorged, except a lot worse than that, but that just gives you an idea. And whenever she was like making me push on them, like she had her hand on top of mine and like pushing, it was like a gurgling sound. Like, I'm trying to compare it, like maybe whenever your stomach gurgles, like that, except just in your chest, and you can feel it on the inside of your body. It's weird, but that's air bubbles in there. So, anyway, that was really weird, and it does it on both sides. But she said all that's normal. So, I just have to keep doing the breast massages as often as possible. And the arm stretches. I can get my arms up like this, and I put my own hair up. So, doing okay there. I still need help, like, putting on my clothes, and, like, I can go to the bathroom and pull up my own pants, but if my pants get too far down, it's hard to pull them up. So, just pulling, whenever you pull anything, like, it, like, stretches your pectoral muscles, and it hurts, and it just feels weird. So, and also you want to, if you, like, I'm right hand dominant, if you do a lot of stuff with your right hand, you need to try to even out with right and left, or else you're going to have lopsided boobs for like a week or so. So I'm trying to do stuff with both arms instead of just one, which you got to stop and think for a minute before you do it. But I think that's about it. So, thanks for listening, and if anybody has any questions, let me know. Thanks, everybody.